So hello everyone. My name is Zhiling, and I'm a first-year biomedical engineering master student, supervised by Dr. James Drake and Professor Jessica Burgner-Kahrs. And I'm going to present about the project Concentric tube robot path planning for epilepsy with 3D slicer. Next slide, please. So epilepsy is a neurological disorder which affects more than 15 million people worldwide, with 30% of patients requiring surgical intervention as primary treatment. Recent studies have shown major advantages of robotic surgeries on reduced pain, recovery time, and scarring. So for each procedure, the surgeon usually needs to manually define the possible incision approaches for each patient. However, it is difficult to optimize for multiple criteria using manual placement. So therefore, the goal of the project is to bring necessary components together to implement a simulation, planning, and optimization system for teleoperated epilepsy procedures. So the platform the system would be based on is 3D Slicer, which is an open source software that is developed and improved by multiple institutions worldwide. It is very powerful in terms of image processing and 3D visualization. So the teleoperation is achieved using a haptic device on Phantom Omni. It provides transformation matrix of the stylus and have useful functions, including virtual fixtures. Last but not least, I would like to briefly touch on the tool, concentric tube robots. It is a class of continuum robots that consist of nesting, pre-curved tubes that are each made of elastic material and fit concentrically one inside the next. So each tube can slide and rotate with respect to each other. And the advantages of concentric tube robots include their flexibility, smooth curve motion, small size, and so on. Next slide, please. So the major components of the system are a planning and optimization module and a simulation module. So input to the planning process is a 3D model of the important anatomy and the robot model, where anatomy model is segmented and reconstructed from the patient's MRI DICOM images through interpolating between slices. The planning process is iterative. First, the optimization problem is formulated based on anatomical constraints and the robot parameters. And optimization goal is to maximize the resection volume. As multiple incision sites are possible, multiple good solutions may exist. Second, the solutions are translated into robot-specific plans, use robot kinematics. And after the translation, the surgeon can select the path either based on the algorithm suggestions or based on menu selection. If the result is not desired, inputs can always be modified and start the process again. Next slide, please. So the simulation module would be consisted of haptic device interface and the visualization module in 3D Slicer. The interface is constructed using Plus, a server toolkit for data transmission, and the server is specifically configured to use the haptic device API to collect movements of the device's stylus, as well as the state of the button on the stylus. Some simple data processing like frequency filters were also applied before sending the data to Slicer to improve the quality of the recorded data. Data received in Slicer is in terms of transformation matrices that contains the haptic device's information, which can be translated into position and orientation of the tip, which can be further translated into robot joint parameters using inverse kinematics. And robot configuration can then be simulated using its forward kinematics. And another important feature implemented in visualization is collision detection, because touching certain anatomical structures like vessels need to be warned in teleoperation. And an example of collision detection is shown on the right. Picture at the bottom shows a sample simulation window with two trajectory views, one endoscope view, three standard views, and 3D visualization. And that wrapped up my presentation, and thank you very much for listening.